I have complex medical needs. Why did a family doctor turn me away? A cruel fact about Ontario's family doctor shortage is that the patients who need primary care the most often have the hardest time accessing it. We're talking about patients who have complex medical needs, chronic conditions, complicated mental health issues, overlapping diagnoses. The list goes on. Sadly, these patients often get turned away or dropped altogether. They're called orphan patients. Why does this happen? Are these doctors just heartless? Last episode, we talked about how family doctors get paid. Most family doctors are small business owners or independent contractors who bill the government for their work, either per visit or an annual fee per patient. They use that money to pay their clinic and staffing costs and then themselves. Here's the catch. Doctors can't charge more for longer appointments. For the most part, docs get the same fee whether they're with a patient for 5 minutes or an hour. And that's leaving aside the paperwork. If a doctor's practice is entirely made up of patients with complex needs, they might not be able to see enough people to pay the bills. There's another obstacle that can be hard to talk about. Through no fault of their own, because of their conditions, these patients are often more challenging for doctors, both professionally and emotionally. And burnout and worsening mental health are huge problems for Ontario's family docs. GPs are left to make an uncomfortable calculation. How many complex patients can they accept while still running their business? Ontario has tried to help, offering incentives like one-time payments for enrolling complex patients and higher fees for specific cases. But many doctors say it's still not enough. There are alternatives. There are roughly 75 community health centers in Ontario. These nonprofits offer all kinds of health and wellness supports, including salaried doctors who earn the same amount no matter who they see and how long an appointment takes. But 75 centers is just a drop in the bucket. Fixing this isn't simple, but the system isn't working for patients or for doctors. Thanks for watching this episode of Nerds on Healthcare. Got questions about Ontario's healthcare system? You can find me on Blue Sky. If you've enjoyed this video, hit like and subscribe and click anywhere around me for more helpful explainers. See you next time.